Today, we're diving into one of the most incredible frontiers in medicine. We're talking about using artificial intelligence to, get this, see the future of our own health, to predict diseases long before a single symptom ever shows up.
I mean, just think about that for a second. It sounds like something straight out of science fiction, right? But this is the question researchers are asking right now. What if we could completely flip the script on medicine, moving from just reacting to sickness to actually proactively preventing it? This one question is kicking off a massive revolution in healthcare.
So to really get why this is such a game changer, we have to start with the problem. And the problem is, for so many of the worst diseases out there, we're simply losing a race against time. We catch them way, way too late.
Take a look at this number. It is just staggering. Pancreatic cancer, its 5-year survival rate is only about 12%. And the main reason for that is that by the time you feel sick, by the time a doctor can make a diagnosis, the disease is usually already in an advanced stage. And that makes treatment incredibly difficult.
And it's not just cancer. Think about neurodegenerative diseases like Alzheimer's. A diagnosis there is basically a confirmation of damage that's already been happening, silently, for years. This whole reactive approach means we are always one step behind. So it's pretty clear, we desperately need a better way to see what's coming down the road.
And that is where artificial intelligence steps in. The best way to think about it is to imagine AI as this unseen detective, a detective that can sift through literal mountains of data to find tiny clues that are completely invisible to the human eye.
I absolutely love this analogy because it just makes the whole concept click. You know how meteorologists look at all this atmospheric data to predict a storm? Well, AI is starting to do the same thing with our health data to forecast disease. It's all about spotting those subtle signals long before the storm actually hits.
Now, the real engine driving all of this is a specific kind of AI called machine learning. And the key idea here is that you don't program it with a bunch of rules. You don't tell it, if you see this, then do that. No, instead, you just feed it massive, and I mean massive amounts of data, like the health records of millions of people, and it figures out the hidden patterns all on its own.
Okay, so how does it actually work in practice? Well, you can kind of break it down into a 3-step process. First, the AI gobbles up all this data. We're talking electronic health records, scans, doctor's notes, even data from your smartwatch. Then, the magic happens. It learns how to connect thousands of tiny little data points that, to us, would just look like noise. And finally, it spits out an early risk score, basically giving doctors a huge head start.
So let's look at a really fascinating case study here, predicting Alzheimer's. The incredible part isn't just that it can be done, but how it's done. Not with expensive brain scans or invasive tests, but by simply reading the notes your doctor writes down during a checkup. Now, this diagram might look a little complicated, but the idea behind it is actually pretty simple. A model called AD-BERT was basically taught to read medical notes. It looks at the notes for patients who have what's called mild cognitive impairment, or MCI, and it analyzes the specific language the doctor used to predict how likely that person is to develop full-blown Alzheimer's down the line.
And would you look at the results? They're really impressive. Now, don't worry about the jargon here. F1 score and AUC are just fancy ways of measuring a model's accuracy. Think of it like a test score. The higher the number, the better it did. And you can see that the specialized AD-BERT model clearly scored higher than a more generic one. It just goes to show that training the AI for one specific job makes a huge difference.
And this is where it gets really cool. This brilliantly shows you how the AI thinks. It's called an attention map. The more read a word is, the more important the AI decided it was for making its prediction. It learned all by itself that phrases like memory, difficulty recalling dates, and short-term memory loss were the big red flags. It's not magic, it's just pattern recognition on a scale we've never seen before.
But the potential here goes so far beyond just one disease. Let's look at how this exact same approach is being used to fight 2 of the biggest killers on the planet, cancer and heart disease. Okay, get ready for this, because this finding is just wow. Using a technique that's basically about finding subtle patterns in images, one AI model was able to spot pancreatic cancer on CT scans a median of 398 days before human doctors did. 398 days. That is more than a year's head start. I mean, just imagine the difference that kind of lead time could make. This slide right here really captures the massive paradigm shift we're talking about. For so long, medicine has been reactive. We wait for symptoms, we find the disease, we treat it. But AI lets us become proactive. It's pattern-based. It allows us to screen for risk long before the disease even has a chance to take hold.
And you're seeing the exact same revolution happening in cardiology. AI models can now look at a totally normal-looking EKG and predict a person's future risk of developing atrial fibrillation. And with wearables like the Apple Watch becoming so common, this kind of data collection is happening all the time, feeding these models that can spot tiny, subtle shifts in our day-to-day health.
So what does this all add up to? What does all this technology mean for the future of your own health? Well, it signals a fundamental change in what a doctor's visit even is, a shift from just treating sickness to actively maintaining wellness.
Now, this is a really, really crucial point. The goal here is not to replace doctors with some algorithm. Not at all. It's about empowering them. Think of AI as a powerful new tool, like a new kind of stethoscope that can hear the super faint signals of future disease, giving our doctors the ability to act earlier and way more effectively.
The promise here is just immense. We're talking about prevention plans that are truly personalized to you, not just based on some broad average. We're talking about treatment that can start at stage 0, not stage 4. And what that all means ultimately is better outcomes, longer lives, and a much, much higher quality of life.
But let's be real for a second. This amazing future isn't a sure thing. There are some huge challenges we have to solve first. For example, if an AI is trained on data from just one group of people, it might not work well for others. Patient privacy is absolutely 100% non-negotiable. And of course, we have to make sure that a human doctor is always in the loop, making the final call.
So, here's the thought I want to leave you with. Every checkup you have, every scan, every single note in your medical file, it's all just a data point in a much bigger story. With AI, we are finally building the tools that can actually read that story and tell us what's coming next. The only question is, are we ready to listen?